So today I'm going to be talking about racism as a public health crisis, which is an issue that Venerable Children had suggested somebody give a BBC about a little over a week ago. And that was very timely because there have been a number of cities and counties around the country that have come out with resolutions declaring racism as a public health crisis. And this is, of course, in light of all of the protests and demonstrations that have been going on around police brutality and also the effects of the coronavirus hurting minorities more than others. So an example is that just last week, the Boston mayor called racism a public health crisis, and he said he would reallocate $3 million from the city's police department's overtime budget to address the issue. And he would consider transferring an additional $9 million from the overtime budget to support initiatives for housing and women and minority-owned businesses. This is quite amazing. The city councils of Cleveland, Denver, and Indianapolis have voted to acknowledge racism as a public health crisis, as well as officials in San Bernardino County, California, and Montgomery County, Maryland, which is very close to DC. And already in August of last year, Milwaukee County, Wisconsin, became the first local government in the country to declare racism a public health crisis. And they pledged to assess all government policies for racial biases and mandated training for county employees on the effects of racism. Some state legislators in Ohio have introduced a bill that would make it the first state to declare racism a public health crisis. In a recent interview, the Ohio House Minority Leader Amelia Sykes said that there are two viruses plaguing the U.S. communities, one of which came into existence about a year ago, and the other one of which has been around for over 400 years. So as we learn in the Buddhist system of reasoning and debate, when we want to analyze an issue, we have to first start by looking at the definition so that we're all on the same page. So I looked up what is institutional or systemic racism. And according to the former president of the American Public Health Association, Dr. Kamara Phyllis Jones, institutionalized racism is a system of structuring opportunity and assigning value based on the social interpretation of how one looks, which is what we call race, which unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strength of the whole of society through the waste of human resources. I thought that was pretty hard hitting for a public health expert. And an article on the National Institutes of Health website entitled Uprooting Institutionalized Racism as Public Health Practice says that institutional racism refers to ways that both state and non-state institutions discriminate through policies and practices on the basis of racialized group membership. So this article is interesting because it identified two main racist ideologies which are used to explain the long-standing health disparities between African Americans and whites. And the first argument is the biological inferiority of non-whites, and this dominated US medical thinking in the 18th and 19th centuries. But what's more common nowadays is the idea that African Americans choose to engage in behaviors that are detrimental to their health. And this article criticizes the lifestyle hypothesis as faulty because it overlooks racially based patterning of power and opportunity and ignores the toll that lifelong discrimination can have on somebody's health. So then I looked up what is a public health crisis. And according to one source, it defined it as an occurrence or an imminent threat of an illness or health condition that has significant impacts on community health, mortality, and the economy. So though the recent instances of police brutality and the coronavirus are really spotlighting the effects of racism on health, some researchers and activists have been calling racism a public health crisis for decades. And one of these is the Portland-based advocacy group Right to Health, which in 2006 began urging the National Institutes for Health and the Center for Disease Control to declare racism a national health crisis. And they have a petition on their website if you're interested that you can go and sign and support them. And the reason that this awareness has been around is that the United States has a very high degree of health inequity, which the American Public Health Association defines as the uneven distribution of social and economic resources that impact individuals' health. Public health researchers agree that many of these inequities stem from structural racism and the historical disenfranchisement of racial and ethnic minorities. Racial minorities have been systematically withheld from obtaining resources needed to be healthy. And they're also disproportionately exposed to a combination of health hazards such as poverty, poor housing, environmental waste and pollution, and violence, both at the hands of police and ordinary citizens. And exposure to these conditions has resulted in higher rates of infant mortality, heart and lung disease, and diabetes among African Americans and other minority groups. The psychological stress and trauma of dealing with racism is being recognized as a public health crisis within itself. And a professor of behavioral health at the University of Alabama cites systemic racism as a chronic stressor that negatively impacts the physical, emotional, and mental health of African Americans across their lifetime. The American Psychological Association has found that stress associated with racism increases an individual's risk for chronic conditions like heart disease, diabetes, and inflammatory and autoimmune disorders. Researchers are now looking at the effects of intergenerational trauma on Blacks in America who have seen friends and family members murdered at the hands of police and private citizens. This idea of psychological stress really interested me, probably because we study the mind in Buddhism. And so I want to share an idea of what living with constant stress and fear could be like. And one of the nuns here sent around an article that interviewed 3 African American men living in Spokane, Washington, which is the closest city about an hour away. So this interview asked them, do you ever feel safe, among other issues? And all 3 of them said no. And I wanted to quote 2 of them. So one of them said, "While I do not fear any man or profession, I do fear hate and racism. I carry a registered concealed firearm with me daily. I position myself with my back to the wall in establishments. I notice every exit point when I enter unknown spaces. I look to see if other Black people are present. I know from my parents and the talk that I need to dress, act, and behave a certain way in certain spaces, or I can become a victim. I've had the talk with my 2 sons because I feel in fear for their safety." Then another man described what happens when he gets pulled over by the police. He said, "When I'm getting my license and registration out before the officer gets to my window, I'm rehearsing my tone to make sure it's not coming off as disrespectful or threatening. I'm sweating, my heart is racing. I'm gripping the steering wheel with both hands, and my voice is shaking while talking to the officer. My concern is making it home to see my family." So hearing this account, it's probably no surprise that police brutality has also been cited as a public health crisis, particularly affecting African Americans. The National Medical Association, which is an organization representing African American physicians and patients in the United States, released a statement in June showing that Black people are 3 times more likely to be killed than whites. More unarmed Black people were killed by police than unarmed white people last year, and police killings are the 6th leading cause of death among men of all races aged 25 to 29. We've been hearing a lot about the coronavirus, and a new aspect that's come out is that it's really uncovered a lot of the institutionalized racism in the US healthcare system. And there was some demographic data that NPR analyzed showing that African American deaths from COVID nationwide are nearly 2 times greater than would be expected based on their share of the population. And Hispanics and Latinos also make up a greater share of confirmed cases than their share of the population. And this is in 42 states and Washington, D.C. And interestingly, health officials stress that higher rates of COVID-19 among minorities are not due to genetic causes, but rather to the impact of public policy decisions that have left communities of color more susceptible to catching the virus and experiencing the worst complications. Black and Latino people make up a large proportion of the frontline workers who are exposed to the virus, yet lack adequate testing to treatment and adequate access to testing and treatment. In a webinar that we watched yesterday, neuroscientist Richard Davidson said that African Americans in the 35 to 45 age range are 10 times more likely to get COVID than whites. So shocking. So why is this a problem? I mean, it has big economic impacts, but as spiritual practitioners, this is definitely something to be concerned about, because we recognize that all sentient beings have an equal right to be happy and to be free of suffering on both the mundane and the transcendental levels. And as Buddhist practitioners, one of our goals is to cultivate love, compassion, joy, and equanimity equally for all beings. So this goes against any racist or discriminatory attitude that views some people as more deserving of love and compassion than others. And also, as Mahayana practitioners of Buddhism, we pledge to lead all beings out of suffering by attaining Buddhahood, which means that we need to know how to communicate and feel connected to groups that are marginalized by society. So then, what can we do to address the situation? And there's a lot of good thinking going on about this right now. The American Public Health Association released a pamphlet containing many recommendations that public officials can adopt in order to improve health equity in the country. The first recommendation is admitting that health discrepancies actually exist, and then naming the vulnerable populations that are affected. Applied on the individual level, this means that we should not remain silent about discrimination or bigotry and look the other way. As one of the African American Spokanites said in the article, silence about racism is just as bad as expressing racism. Healthcare professionals and those working in the healthcare industry have a particular responsibility to address racism within their institutions as well as within themselves. But the pamphlet recognized that health is the result of many causes and conditions, not all of which are medical. The main ones being education, which is the strongest indicator of lifelong health, employment, housing, and neighborhood conditions. Yeah. And this shows that everyone in society has an impact on the health of everyone else. And in this light, I think we can see that reducing racism in this country has to start with ourselves, by examining our own hearts and minds for any instances of racial bias or prejudice, and then taking steps to uproot them. Social movements are great, but they will not have lasting effects unless we are willing to address the distorted ways of thinking that enable racism to continue. Now, examining our own minds for racist and biased thoughts can be difficult due to shame and fear, but there's an online test by Harvard University that can help determine if you might have some implicit bias against certain races, genders, or other groups of people. And the good news is that if you do have any implicit bias, meditating on compassion will reduce that, which we just learned yesterday in a webcast with His Holiness Dalai Lama on resilience, compassion, and science. So another way that we can work to overcome personal bias and prejudice is by changing how we interact with people. One nonviolent communication counselor, the Abbey knows, who lives in Portland, publishes a weekly newsletter, and the topic of the most recent one was finding a new quality of connection. In it, she provided strategies for developing quality connections with people who are different than us. And the way that we can tell if a connection is one of quality is that they contain the following elements. So the first is you recognize the universal humanity in yourself and the other person. You feel care and compassion for your own and another's experience. You feel vulnerable because you are sharing authentically from the heart. You feel curious about your own experience or another's. You trust a balance of listening and being heard. And you prioritize staying connected and are not willing to sacrifice the connection for the sake of asserting your view or opinion. So I think that if we can approach other people with this attitude, especially those that are different than us, we're both more likely to express what's meaningful for us and then reach some common ground. So in order to develop these types of connection, the newsletter recommended developing empathy, which involves identifying with the universal needs expressed in other stories. And this one, I think, is important, acknowledging our own fear, shame, and discomfort, which will allow us to stay grounded and relate from our heart. And then finding opportunities to step out of our comfort zone and build trust with groups or people who are in need of support. So in Buddhism, we practice thought training to see the positive aspect of any situation and to use it as an opportunity to increase our wisdom and compassion. The current spotlight on racism and police brutality in the United States provides a great opportunity not to reform just institutions, but to increase love and compassion within our own hearts and minds. There was a wonderful Rolling Stone article entitled, "Racism Kills, Why Many Are Declaring It a Public Health Crisis." And it pointed out that one benefit of the COVID outbreak is that we're finally getting used to thinking of health in terms of interconnectedness, rather than solely on an individual basis. And as practitioners, we can expand this understanding of interconnectedness to all activities that we engage in every day. And perhaps the most uplifting aspect of addressing racism is that it will benefit all sentient beings, no matter what color they are. And this is reflected in a quote by Amelia Sykes, the Ohio minority House leader mentioned earlier. And she said, addressing racism as a public health crisis won't help just Black people. It'll help every single person in the country. This is not us versus them. It's us versus oppression, us versus alienation, us versus hatred. There shouldn't be any reason why people can't grasp this and want to support it, because this is supporting every human being. So if we do decide to take any steps to reduce racism, whether in our communities or in our families, our homes, or ourselves, may we remember to dedicate the merit as one of the causes for us to reach full awakening so that we can benefit all beings, no matter what color they are.